lot of people don't know, but there is a subcategory called pre-diabetes. We're going to talk about the different types of diabetes, risk factors, medications that induce diabetes. A lot of people don't know, but some of the medications that you're taking can cause you to have diabetes. Signs and symptoms, diabetic medical emergencies, whether you are too low or too high, checking your blood sugar levels, and maintenance and recommendations. Okay, so the first thing is defining diabetes. What do they say diabetes is? According to the Center of Disease and Control, diabetes is a chronic, long-lasting health condition that affects how your body turns food into energy. So most of the food you eat is broken down into sugar, also called glucose in the medical sense, and released into your bloodstream. When your blood sugar goes up, it signals to your pancreas, which is a very important organ in your body, to release something called insulin. Insulin acts like a key to let blood sugar into your blood cells for use as energy. So think of insulin as the key to the door to let sugar into your blood cells to give you the energy that you feel in the morning to wake up, to walk, to do the things that you do. If you have diabetes, your body either doesn't make enough insulin or can't use the insulin it makes as well as it should. When there isn't enough insulin or cells stop responding to insulin, too much blood sugar stays in your bloodstream. Over time, that can cause serious health problems, such as heart disease, vision loss, various skin issues, and kidney disease. Okay. Pre-diabetes now. A lot of people don't know about this subcategory, but according to the CDC, and I'm just speaking for the United States, I know some of our attendants are from different countries. In the United States, 88 million adults have pre-diabetes. This means 1 in every 3 person has this condition. So 84% of them don't know they have it. So a lot of people don't know. It's not something that you'll feel unless you go into, like, for example, the diabetic emergencies that we will cover later on. With prediabetes, blood sugar levels are higher than normal, but not high enough yet to be diagnosed as type 2 diabetes. Prediabetes raises your risk for type 2 diabetes, heart disease, and stroke. But the good news is if you have diabetes, a CDC recognized lifestyle change program can help you make healthy steps to reverse it. So if we look at my diagram that I have over on the side, for pre-diabetics, we're going to talk about A1C later. A1C is basically an average of your blood sugar over the past 3 months, and they do it based on percentage. For pre-diabetics, there's something called fasting blood sugar test and glucose tolerance test. A glucose tolerance test is basically you're drinking something sugary, or I give you something really sugary, and we test your blood sugar to figure out what your numbers are. For a fasting blood sugar test, it's simple. You haven't eaten, and we're going to test your blood sugar to see where it's at. So for somebody who hasn't eaten that's a pre-diabetic, their numbers are going to average and range around 100 to 125. For those who we've given something to drink or eat that's really sugary, that number is going to range anywhere from 140 to 199 in that area. We're just going to move up now to the diabetics. Diabetics, fasting, meaning, once again, not eating anything prior to me testing you for your blood sugar, is around 126, right, or above. For the glucose tolerance test, once again, that is if I give you a sugary drink, it's going to be over 200 or above. So as you can see, the numbers are right, for pre-diabetics, the numbers are right beneath. Okay. There are 3 types of diabetes. On this diagram, I'm only talking about 2. The other one we'll discuss right after. So for type 1, it occurs when your pancreas, we talked about that important organ earlier, the one that gives insulin to distribute sugar into the blood cells. The pancreas is unable to produce enough insulin. This diabetes is typical for young age individuals. It's usually called juvenile diabetes. It cannot be prevented. We are basically thinking that it's genetic. It requires insulin therapy. So a lot of my type 1 diabetes individuals are insulin, what you call dependent. Type 2 diabetes, on the other hand, occurs due to insulin resistance. So whereas on type 1, they're not making enough insulin, your pancreas just isn't making enough. Type 2 is just insulin resistance. Your body is not, the key is not fitting into the lock.